Joe, I just want to thank you for taking a few minutes out of your day to let me interview you on the Canadian healthcare system.
You're welcome.
Joseph Blank is a physical trainer, and he is a Canadian expatriate living in America. He has both dual citizenships to Canada and to the United States, and I thought that would give us a unique perspective on the Canadian healthcare system. Joe, are you satisfied with the Canadian healthcare system?
Absolutely.
Why?
Well, the healthcare over there does not cost me anything, and it's more than satisfactory.
Does it concern you that it's only satisfactory?
Well, for the most part it does not, because if something needs to be done, it gets done. There are incidents where people will come to the U.S. if they can afford to get a certain procedure done, where they may have rather had to have waited a little while if they would have been in Canada. But other than that, I think the healthcare is great.
Are you... what province are you from?
Ontario.
Uh-huh. What health insurance do they have over there?
They have something called OHIP. It's Ontario Health Insurance, general health insurance given to all the residents.
Do you have to pay copays over there?
You do not.
When you see a doctor, you don't?
You do not.
And then what about when you pick up prescription drugs?
You have to pay a very minimal fee.
How minimal compared to the States?
Very minimal, probably less than 10% of what you would have to pay over here.
So over here you would have to pay $40 copay, over there?
Maybe a few dollars, $3 or $4.
Really? Have you ever been to the emergency room?
I actually think of an incident when I was in elementary school that I have, and it wasn't such a bad experience. I got seriously injured, I needed to have something done, and it went pretty smoothly. I was on the emergency bed. Before I knew it, I was out.
Do you like, are you more satisfied with your health insurance over here or over there?
Well, over here I'm paying for it, so the level of care is a little bit better, but I can't say that there's too much of a difference between what I'm getting there and what I'm getting here.
You mentioned that you have a personal situation in long-term care.
Yes. My mother is in long-term care in Canada, and I would say she's been in that situation for about a year and a half now. And myself and my family are pretty satisfied with what we've had to endure and her current status. And I've also thought many a time how much it would cost me if she was over here. It's sad to say, but I don't know if I would have been able to afford to give her the basic proper care.
The basic proper care. Do you think that the United States should adopt universal health care?
I think that they should.
Why?
Well, I think that it's a moral, ethical right for every citizen to be able to have the health care that they need. It can always be a little bit of a complicated matter to get it implemented, but if we could snap our fingers and have it that way, that's the way it should be.
Would you consider moving back to Canada because of the health care?
Absolutely.
Joe, would you move back to Canada because of the current healthcare crisis in the United States?
Absolutely would.
Why would you do that?
Well, it's just a wonderful feeling to know that you're in a place where everyone's medical issues are going to be taken care of. If there's ever any kind of problems, I don't have to worry about my insurance. If I got married and which I plan to do, and God willing have children, have a family, I'm not going to have to worry about the different medical related expenses that people have to endure over here. Different kinds of co-insurance costs and what have you.
I thank you for your time, Mr. Blank, and I really appreciate it. Thank you.